Hello everyone and welcome back to my channel. I'm Dr. Shalok Munjal and today we are diving into comprehensive discussion on autism spectrum disorder or ASD. This video will cover the definition, core deficits, Asperger's syndrome, epidemiology, pathogenesis, evaluation, and both non-pharmacological and pharmacological treatment. Let's get started. To introduce, autism spectrum disorder or ASD is a complex neurodevelopmental condition characterized by challenges in social interaction, communication, and repetitive behaviors. The term spectrum reflects the wide range of symptoms and severity. ASD is defined as by the Diagnostic and Statistical Manual of Mental Disorders, DSM, as condition with persistent deficits in social communication and social interaction across multiple contexts, along with restricted repetitive behaviors, interests, or activities. The core deficits of ASD include social communication and interactions, difficulties in understanding and responding to social cues, maintaining conversations, and forming relationships. Additionally, as for the restricted and repetitive behaviors, these include repetitive movements, insistence on sameness, highly focused on interests and sensory sensitivities. Asperger's disorder, which was previously considered a separate condition, is now part of ASD spectrum under DSM-5. Individuals with Asperger's typically have milder symptoms and do not have significant delays in language or cognitive development. ASD, or autism spectrum disorder, affects approximately 1 in 54 children in the United States, with a higher prevalence in boys than girls. The reason for this gender disparity is still being researched. As for the pathogenesis of autism spectrum disorder, it involves both genetic and non-genetic factors. Genetic factors include numerous genes that have been associated with ASD, indicating a strong hereditary component. Mutations and variations of these genes can affect the brain development and function. As for the non-genetic factors, the environmental influences include prenatal exposure to certain drugs, infections, and advanced paternal age, which can also contribute to development of ASD or autism spectrum disorder. As for the evaluation, these evaluations typically include a multidisciplinary approach, including developmental screening, which includes early identification through regular checkups, and also comprehensive diagnostic evaluation, which includes ADOS, which is a survey, and in-depth assessment by specialists, including developmental pediatricians, neurologists, psychologists, and speech and language pathologists. The non-pharmacological, which means non-medication-based treatments, focus on behaviors and educational intervention. These include applied behavioral analysis, which is a widely used approach that reinforces positive behaviors and reduces negative ones. Additionally, speech and language therapy can be used, and it helps to improve communication skills of the patient. Additionally, occupational therapy can also be quite useful as it assists in daily living skills and sensory integration. As for the pharmacological treatment, which is medication treatment, they help manage specific symptoms that are associated with ASD, not in particular ASD as a whole. There is no particular medicine for ASD, but there are medications for the symptoms that are associated with ASD. These include antipsychotics such as risperidone or aripiprazole for irritability and aggression, antidepressants such as SSRIs or SNRIs for anxiety and depression, and stimulants such as methylphenidate, amphetamines, or non-stimulants such as atomoxetine for ADHD, attention deficit hyperactivity disorder, related symptoms. In conclusion, to understand autism spectrum disorder, it is crucial to provide effective understanding and pursuit of research into this field. Individuals studying with ASD require support and interventions, and it's important to give them grace and experience life through their lens. If you found this video helpful, please like, share, and subscribe for more content on neurodevelopmental disorders and other medical topics. Thank you very much for watching.